All right, what's up? Dr. Webb here. I've actually never did a live like this. This is something that I have never done, but let me know if you guys like it or not. Just watching ESPN, just got home from the hospital. The Raiders player Trent Brown, who somehow got a air embolism, and I just wanted to jump on and talk about that. But we'll let a few more people kind of jump on. Just here about to watch the Cowboys get beat. Let me know who do you guys think is going to win the game tonight. But for those who didn't know, they just came out on ESPN. Trent Brown for the Raiders. Somehow he got some air that was maybe in a IV. Then got into his bloodstream and had to go to the hospital. But I just wanted to talk about that. So thinking back to medical school, one of my deans of the medical school on our first day as medical students, and she wanted to talk to us about just being very careful in the hospital and not, letting your guard down. Make sure you study real hard. And she probably did this to scare us as well, to make sure that we were actually studying and we were actually doing everything that we needed to do so we were ready to go in the hospital. So she told us a story of a time a resident told a medical student to go up and take a central line out of a patient. If you don't know what a central line is, a central line is it's a catheter. It's a long catheter that we use to infuse lots of fluids and lots of medications to patients that are very sick. Patients also get them if they're getting prolonged antibiotics, if they need some type of infusion for prolonged period of time. They get what's called either a PICC line or a central line. Well, this resident told the medical student to go up to this patient's room to take out their central line. As medical students, we're always trying to, figure out things to do, and we're kind of eager, and, we want to do procedures, get our hands and feet wet. But this medical student went up to the patient's room. I guess he pulled the central line out of it's usually like in the subclavian or one of the vessels up here. I don't put those things in, but he told the medical student, took out the central line, and what you're supposed to do is you're supposed to hold pressure over that IV, over that area, so that air from the outside doesn't get into the IV or the hole that's right there and cause a air embolism. But the medical student didn't do that. Air got into the patient's it got into the patient's vein, and the patient died. So we were like, what the hell? This is our first day as medical students about to go into the hospital, and she's telling us about this. So this is a pretty serious injury. It can cause a lot of different things. If you get air into your bloodstream, it can cause heart attacks, strokes, respiratory failure. You can actually die from it. So when I heard this, I thought that reminded me back to what my dean kind of stressed, the importance of, if you're not trained in something, you shouldn't be doing that in the hospital. And that was the whole premise behind her story, and that she was trying to make sure that we study and know exactly what we need to know for the hospital. So it looks like Trent Brown, I guess he was getting an IV maybe before a game. And then sometimes they do this for, to get more energy, replace electrolytes. You'll see him on the sidelines with oxygen, trying to get their reserve up and ready for the game. But, in the NFL also, you have all these injuries and patients that are getting hurt. They get pain medications too. A couple weeks ago, one of the Los Angeles Chargers doctors, Tyrod Taylor, gave him a pregame pain injection and punctured his lung. So that's not what you want to do. But an air embolism from Trent Brown, from the Raiders, it's when air gets into your bloodstream. This can, people talk about this all the time with like scuba diving, with if you're taking out an IV, you don't put pressure over it. Patients on ventilators, they have all that high pressure that's going into their lungs. Well, this can be very deadly. I hope that he recovers and he can get back on the field. But I just wanted to quickly make this. I'm busy today. I didn't really have time to make a full video, but I wanted to just give my thoughts on this. Answer a few questions. Anthony said, "What's an air embolism?" Essentially, a embolism is some type of object or medium that gets into bloodstream. So you can have a fat embolism where fat gets into the bloodstream. You can have a air embolism with air gets into it. You can have what's called a blood clot, which means you have a collection of blood that travels throughout your body, goes to your lungs. Yes, it can cause shortness of breath. That's what one person kind of mentioned. Fat embolisms we see that a lot. We see it in orthopedics. So when I'm fixing a patient's femur fracture or a patient's hip fracture, and I'm sticking what's called a reamer that goes down on the inside of their bone. On the inside of the bone, it's the bone marrow. There's a lot of fat there. So I can push that fat and it can go to their lungs. So that I've seen patients kind of get really sick from that in the middle of one of our operations. But that's what a air embolism is. I'll take a few more questions as well. Who was at fault in this situation? The student or the teacher? I'm not sure. Neither one is a student or a teacher. But I'm not here to cause any blame, report any blame, or point fingers. I'm here to just educate you guys. All right. What other questions do you guys have? I'm going to answer a few more questions. Yes, I'm working today. I'm on call. I was on call all weekend. I saw 20 patients today that were in the hospital at 4 different hospitals. I have videos that I'm going to be making about my journey so far. Very busy weekend. Arterio, thank you, man. I appreciate it. Big Boss, what am I doing tonight? I am getting ready for the week. About to watch this Cowboys game, watch them lose. Andrew Buck, you applying to gyms. Good luck, man. It's a great program. Rashawn Patel, good luck on your cell bio exam tomorrow. Study hard. Nurse Life Wits, I love the channel. Appreciate that. Mohammed, did you take your pre-meds, all your pre-meds at once? I took them a few classes at a time. Who else? Cowboys losing already? Oh, crap. That's crazy. Any tips for orgo? Oh, my God, I hate orgo. One of my least favorite classes. You will never need any of that information again. You just need to get through it. Why is osteomyelitis tough to treat? Michael Myers. Osteomyelitis is an infection in the bone. It's tough to treat because the bone is not it doesn't have a good blood supply. So it's, getting antibiotics are, hard to kind of get to that area. So sometimes it takes 6 to 8 weeks of treatment to treat osteomyelitis. When will you be able to pay off all your student loans? Hopefully soon. Mark, I had a compression fracture and fusion. After my fusion, my legs hurt. What can I do? I cannot give medical advice out. You can contact my office. We can talk about that. My teachers told me pre-med is not for me. Should I give up? They told me the same thing. No, you should not give up. Who's your favorite NBA team? Oh, man, that's a good question. People say I look like Kevin Durant. What do you guys think? I don't think I look like him. I think my hair is, I think I got better hair than he does. But, I live in San Antonio, so I got to go with the Spurs, even though they suck. Are you going to be doing research now that you're in private practice? Yes, a little bit of research. Someone just reached out to me about a research project, about writing a paper. Your channel was awesome and amazing. Thank you, I appreciate that. What's the most confusing term you have learned in your journey? I have no idea. Oh, well, I'll give you an example. There's 3 terms in spine surgery. One is spondylolisthesis, one is spondylosis, and one is spinoptosis. Those all have different kind of meanings, but those three can be very confusing for a lot of people. Iker, is it possible as a surgeon to specialize in two specialties? Absolutely. You can specialize in spine surgery. You can specialize in pediatric spine surgery. But most people do one fellowship. My classmate from residency, co-resident, she did pediatric fellowship and then she did a sports medicine fellowship. So she did two. What's my favorite surgery to do? What's up, Hector? I enjoy doing spine surgery. I love anterior cervical surgery. So going through the front portion of the neck, we go through we move the trachea and esophagus out of the way. We protect the external jugular vein. And there's some really important structures there. The recurrent laryngeal nerve, you have to be careful of, and a lot of other important structures, but I love the anatomy. What's your opinion on people getting BBL? Do you think it's dangerous? I don't know. I'm a spine surgeon. I don't do BBLs. How do you research in medical school? Well, there's lots of different opportunities where you can do research. There's people that are at the school that are researchers, and there's lots of opportunities to get research published and get on some projects. Does surgery make you nauseous? No, it does not. For some people, it does. What else you guys got? I got a few more minutes. I got to get back to work. How did the Air Force affect you as a physician? It did not affect me. It helped me be a better physician. How and when in your career will you stop being on call? If you're a surgeon, you're always on call. But like formal call where, you're getting called by the ER, some people stop taking it after their first few years out in practice. Other people take it for years on end. But it just depends on, your practice and how much money you want to make. Some people take call to make money. Other people don't like being on call. Me, I'm young and I'm hungry, so I'm gonna take a lot of call. And but as a surgeon, you can have a patient that you did surgery on, and she comes to the ER for a blood clot or infection, and they call you because you're her doctor. So even though you may be at home with your family, you're not on call. You may still have to go in and do that surgery. I was thinking of hey, Julian. Hey, I appreciate that, man. I saw you on my floor yesterday at MSOH up on telemetry. Big fan of you, my man. Thanks for taking care of my patient. Dylan, what's up? Hey, next time you see me, man, let's meet and connect. That patient was one of my 20 patients I saw yesterday. It was a busy day. Did you know from the start you wanted to do ortho? I always know I like working with my hands, but I didn't decide on orthopedics until my third year of medical school. I didn't decide on spine surgery until my third year of residency. So you don't need to know what you want to do. You can figure that out once you start doing your rotations. A lot of people don't know what they want to do. Thank you, Sarah. I appreciate that. A lot of people don't know what they want to do until later on. Do you change the oil in your car yourself? What kind of question is that? No, I pay people to do that. I don't have time to be changing my oil. As you guys will see, the further you get in your career, you should just start paying people to do stuff for you. Adam, were any of your OBGYN attendants mean? Oh yeah, they were. It was quite a few that were. They were quite mean. That was an interesting rotation. The OBGYNs can be mean. What's up, Smith? Brandon, what's up, man? I appreciate you. What is your opinion on athletic trainers? What's up, Daniel? I think athletic trainers, I still do work with a lot of them. I think that's a good field to go into. Hey, Dr. Webb, MS3 checking in from Texas Tech. Can you discuss rhizotomies? So rhizotomy is a procedure in spine surgery where we burn nerves. These nerves are sensory nerves. Usually they're over the facet joints, and the facet joints are bones in the back of the spine that help you move and bend and twist. These facet joints can be painful, especially when they become arthritic. So a rhizotomy is a procedure in spine surgery where we burn the nerves that innervate those joints. You can do a rhizotomy in the cervical spine, lumbar spine, thoracic spine. But the problem is that these nerves kind of grow back over time. Some patients, I recommend it, and I've done these surgeries before, where we use this machine. It heats up the nerves, and you get rid of those pain receptors. But patients it may last for 6 months, may last for a year. It may not work at all. So I do recommend that for a lot of my patients if I think their pain's coming from their facet joints. What's up, Emmanuel? I appreciate that, man. How do you remain humble? There are so many MCDs I work with. What are MCDs? MDs? I'm just a regular person. I don't think I'm no different from anyone else. I started from the bottom. I was a medical technician. I was an LVN. I used to see people walking around the hospital and they thought they were God, the doctors. The biggest. Some of the doctors around wouldn't speak to you, wouldn't look at you, but I'm very approachable, very accessible. I'm just a regular person. I'm no different from anyone else that is out there. What's a good idea for a systematic review? I mean, there's lots of different things you can do for a systematic review. Just find something that you enjoy doing. But I just wanted to jump on to talk about Trent Brown, who had a air embolism. It just came out on ESPN. I didn't have time to put up a full video, but he was getting an IV at pregame before the game. Somehow there was some air that was injected into his bloodstream. I talked about what an air embolism is. It's basically when air gets into your vessels. So it gets into your artery, it gets into your vein. These can be very dangerous. It can cause a heart attack, can cause a stroke, cause respiratory failure. Sometimes it may not cause symptoms whatsoever, but he was taken to the hospital, and he's getting checked out for an air embolism. And I told the story about my dean in medical school who we were getting ready to go in the hospital as medical students. She told us the story of a medical student who was told by a resident to go take out a central line, which is a catheter in the neck, from a patient. He took the central line out. He didn't hold pressure, which is what you're supposed to do. He didn't hold pressure. Air got into the patient's vessel, and the patient died. So this is a pretty serious injury, and I just wanted to quickly jump on. But thank you guys for joining with me tonight. If you guys like this format, like me jumping on live, answering questions, let me know. I'll try to do a little bit more often. But put it in the comments below. What do you guys think? I'm about to get some work done and watch this Cowboys game, watch them lose. And I will answer one more question. Let's do one more. Let's see. Should I go to the military and come back to college since I'm lazy and I'm motivated? Do you think that's a personal problem I can deal with myself? I'm not sure what you're asking, man. All right. Someone keeps asking, can I shadow you? I'm from Boston, really like ortho. Yeah, unfortunately, man, I'm not doing any shadowing right now. It's kind of a crazy time to have anyone shadow me. But stay in touch, though. All right, cool. I'm about to get some work done. You guys have a blessed evening, and we'll see you guys next time. Let me see how to turn this thing off. Peace.